The next thing that we want to go over is, like we said with Harmon, she was unable to get on the pillows. It was uncomfortable for her at the stage of pregnancy she's at. So if you have to modify your exam around that, what I can do is have her sit or lay down. And I'm going to come down here during your exam. You're doing okay? Mm-hmm. I'm going to compare her leg lengths from here. If I can do it laying down, great. But I'm going to do it from here. I'm going to put my fingers right here. I'm going to also check at the same time for edema. So she has right now +1 edema. If you can see, I leave a thumbprint and it disappears pretty quickly. So just noted that. That's completely common during this trimester. So I'm noting her edema, but I'm also comparing her leg lengths. If I wanted to do her test in terms of orthopedic tests, I can do that on her side, and I'll demonstrate in a second. Or I can swing her legs around. I'm going to bring you around like this. So if you want to do straight leg raiser, if she's having some dizziness and cannot go down on pillows, you can do that from here. You can modify this. Any pain with that?
No.
Any pain with this?
No.
And again, with a thorough exam, you want to make sure you're doing reflexes, motor strength, and the like, but you can do that from a seated position. Last thing is the feet.